Hi, everyone. This is Steve Dellasan, and welcome to this week's edition of CEOs You Should Know. I am thrilled to be joined by David Pomeranz, the president and CEO of RiverSpring Living. David, thanks for being here today.
Thanks for having me. It's great to be here.
We're excited to have you, and we're excited to jump in a little bit about your background and about RiverSpring Living. So let's start off today really talking about your background and what led you to your role as president and CEO.
So it's sort of a bit of an accidental career. RiverSpring is in Riverdale, and I was going to school at Manhattan College, and I was looking for a part-time job, and I took a job there pushing wheelchairs so I could take residents to their activities. So I was 20 some odd years at the time. Figured I'd just make a few dollars on the side, and 40 years later, I'm still sitting there.
It's awesome.
The truth is, my grandparents were deceased before I was born, so I had people act as grandparents, but this really filled a void for me. So I, in a sense, had many grandparents immediately, and they all had people for me to date or to get married to, and it was a really welcoming environment.
That's a really fulfilling environment, too, I'm sure.
Absolutely.
So you mentioned you've been there for over 4 decades to RiverSpring Living. What has kept you inspired and motivated along that journey?
The residents themselves are incredibly powerful and interesting. You know, people think when people get older that they're weak, they're diminished. And yeah, physically, they have challenges. Many of them are dealing with diseases, but they've lived a life, many of them, and they've seen things that generations that come after them haven't. So I like to tell the story that when 9/11 hits, which is a tragedy in this country and certainly in the state, the strongest, most resolved people were the residents of our home. They lived through Pearl Harbor. They had the perspective, understanding that you come through things like that, and they were, in a sense, the strength for our organization. Happens again in COVID. Everybody is going crazy. What's going on? Nursing homes are the epicenter of challenge. Staff are running around worried.
Yep.
What are we going to do? How do we staff the place? The residents, like, we've been through polio. We've seen things like this before. So really incredibly meaningful to see the power, the vitality, and the way these residents live their lives.
Yeah, that's inspiring. I'm sure that there's been many different moments throughout the careers like that, right? What are some of the top transformative moments in the career that have really shaped the organization's growth?
The things have changed in geriatric care over the years. So, when I first started working in the organization, I met a woman on my first day. Her name was Anna Silverstone. Never forget, on the 7th floor. She'd lived there for 25 years when I met her.
Wow.
25 years. In those days, there were no options. So she was widowed. What are you going to do? She went to live in a facility.
Yep.
So the transform of our industry has been that there's so many more options for people. And so they have assisted living, they have home care. So when they get to long-term care, there's lots of options for them. So it's really been interesting to see how they utilize them and how people are now understanding better as time has gone on the divergence of needs for married couples. So if they both live for a period of time, it's more likely than not one of them will develop some kind of memory impairment or some kind of physical frailty. And organizations like us build that in to understand that we have whatever they need so that they can age in the same place with different needs to be met.
Yeah, absolutely. And you guys have been in the forefront of innovation with senior care. What have been some of those biggest advancements that you're proud of?
Well, the one we're most proud of currently is technology. We're doing a lot in the technology space. We've had some real incredible support from some donors to give us the advantage of do some things that we never would be able to do otherwise. I'll just give you a couple of examples. Virtual reality is something that people play with. It's a fun thing to enjoy.
Yeah.
For seniors, it means a little something different. It means they can be transported to places they've never been. In some cases, they go back to places they were born, and it gives them a chance to reminisce where they were previously.
That's incredible.
But one of the fun things is in our rehab program, when people come to us for rehab and then they go back home after they finish their rehab, with virtual reality, we send their family home with a camera. It films their apartment or their house, and they put on the VR. And so when they're with us in our facility doing rehab, they're doing rehab in their own home virtually.
That's
and
awesome.
for them, that makes them feel very motivated. It really improves their interest in doing it. It makes them feel excited that they're almost home. And it gives us a chance to see things in the home which we could advise them about. So if there are wires strewn all over the floor or something that might be dangerous, it gives us a chance to see those and help them to prevent those when they get back home.
That's a really incredible use of technology. Who would have thought that virtual reality would be able to do that?
Also, we have devices that can predict fall risk. So
Okay.
we put you onto a screen. You start to walk. It measures your gait and your speed, and it gives you a score. So it determines whether you are at high risk, low risk, and we can work with you in therapy and do some things to help you have a high risk to avoid that fall.
That's incredible. I know that you've been also, in addition to the technology, spearheading the Hauser Care Connect, which is a national model for implementing new technologies for older adults. Can you share more about that initiative and the impact it's been having?
Yeah, first let me just say the woman Hauser is Rita Hauser,
Yep.
who's a really well-known philanthropist who supports a number of not-for-profits. Um, and she really saw the need for us to, the opportunity really, and the need for us to do some things in this space. And so she has spearheaded all these things, and she's the kind of philanthropist who comes and tries these things out. So one of the things we put in was a robot. So there's a robot when somebody falls and breaks a hip. When they go to a facility for rehab, what generally happens is they have two therapists that give them a wedgie while they're walking down the hall so they don't fall. With this robot, somebody who's had a fall and broken a hip, they go into a harness and the robot guides them as they're walking. So there's no risk. They don't have to be afraid of falling. They have a greater confidence and they improve much faster. So, technology is everywhere. It's in every business. And
Yeah.
people think, well, why would it be in a long-term care facility? It should be everywhere. Where would you go to a hotel that didn't have Wi-Fi? Where would you go to anywhere that wasn't high-tech? I'm in a high-tech studio today. So people expect those kinds of things,
Yeah.
including our seniors. And, our call bell system, for example. Call bells are the number one complaint in all hospitals and all nursing homes in the world. You push that bell. We've been in hospitals and nursing in situations like that. It feels like it's 12 hours before somebody comes. It might be 5 minutes, but it feels like 12 hours. In our facility, when you push that button, immediately it calls the cell phone of the caregiver. The caregiver gets on the phone and says, what do you need? If it's life-threatening, they're there instantly. If it's, I want a cup of water, could you hand me the remote control, they can triage it.
Yep.
In today's world with staffing challenges, it's important to be able to utilize staff as effectively as possible. And this kind of technology really does that for people.
That's amazing. I never would have thought that the different advancements in technology would have such an impact. So it's such an interesting perspective.
Yeah, well, they're people. And, in our facility, older people are doing the same things that younger people are doing. They date. We have a dating program, so they're able to, we call it J dating. I mean, there is J dating. We call it G dating. So for grandparents, I don't want to get in trouble with the J date forms. So grandparent dating, and they fill out forms, and they see if they have common interests, and they go on coffee dates.
That's awesome.
And, people think because they're older that they don't want intimacy, they don't want to be touched, and nothing can be further from the truth. They want to do all the same things they've always done.
That's incredible. I know another partnership you have is the partnership with the New York Presbyterian, and it's been really instrumental in expanding care services. How's that collaboration come about?
So that most things happen because of people. And so we've shared people over time that needed help either from the hospital or for our facility, and you build relationships. New York Presbyterian is one of the finest hospital systems in the world, certainly in New York State. And, they have a lot of expertise and a lot of need for our services. So when people are in the hospital and they're older, generally hospitals are not a great place to be for an older person. There's infections. They need the beds for people that need to have surgical procedures.
Yep.
So they need to move them out quickly to a safe place, and that's one of the roles we play, and we do that for them, and we have rehab for their patients who need rehab. And for us, when our patients need great medical care, we can send them to them. So it's really worked out well in both regards, and certainly during COVID, it was a very important partnership. We actually opened a building on our campus to take care of people with COVID.
Wow.
And there were people that came from the hospital, from New York Presbyterian Hospital, who needed to get out of the hospital because they needed space for people that were sicker. So as they healed and they could get sort of downgraded to a lesser need of a care, they would come to us.
You guys were that destination.
Yes.
That's awesome. Sounds like a
So
fantastic
COVID
partnership.
seems like it was 100 years ago, and yet it really wasn't that long ago.
It feels like that,
Yes.
thankfully.
Yes. Let it stay there.
Well, you guys have had so many different accomplishments throughout the years, and it sounds like you guys are continuing to make those advancements even today. Looking ahead at the future, what are some of your key goals that are on the horizon?
Goals. Just there's a never-ending battle to improve the quality of life. To what can you come up with next that'll
Yep.
give them something more interesting to think about, to do? And I think when I think about that question now, I think really about dementia care, because generally speaking, people go to long-term care when they have memory impairment. And, for a time, memory impairment was a focus in this world, and there's many focuses and many things going on. And I feel like it hasn't really gotten the attention in the last number of years. It should, certainly with COVID and other things going on. And I think there's more work to be done to improve life for people with dementia. I'll tell you one thing we did this year, which I'm very proud of, which is, people generally with memory impairment stay in facilities. And it's like that's their life in a facility. And this year we broke them out. We said we want to go out and do some things and reached out to the Yankees. The Yankees said, you want to bring your folks with dementia to Yankee Stadium? We'll create a special way for you to do that.
Wow.
Lon Trost, who's the CEO of the Yankees, took my call, met with him. He organized this himself. We took busloads of people over to tour the stadium, to walk on the grass with their children. So the same children they took them to Yankee Stadium.
Oh, that's awesome.
And they were able to do stuff. We've done the same thing with Botanical Gardens, the Bronx Zoo. And the idea is people with dementia shouldn't be isolated in a way. They should live the lives they've always led. So I think there's more to do in that space. There's more for us to educate other providers. And, these are people, the numbers of people with dementia is only growing.
Yep.
The numbers are staggering and scary. And I think it's up to us to find new ways to engage them.
That's awesome. What an incredible initiative. And those are probably lifelong memories that you're creating for those families too. Looking ahead, are there any upcoming projects or initiatives that you're particularly excited about?
Well, actually, we're constructing a new building, which we're very excited about. It's called River's Edge. It's what's called a life care community. And this will allow people who come at an earlier stage of their life, and basically they graduate their life throughout their time with us. So they'll live in a very independent setting, golf simulators, fancy restaurants, pools. But as their care needs change over time, they'll be able to move to our assisted living, our nursing home. And again, as I talked about before, the spouses, differing needs. So one could be independent in the River's Edge. One could be in a dependent situation in assisted living. So we're trying to give more opportunities for more variety and more depth to be able to handle people whatever they need.
That's important. Not one size fits all. So it's nice to be able to have that wide variety.
Absolutely.
So looking ahead, I know that there's probably in addition to all the positives, there's probably some unique challenges. What are some of the biggest hurdles you faced in your career, and how did you overcome them?
Well, funding is one of them. Unfortunately, government, whether it be state or federal, doesn't always think about elderly people and their needs.
Yep.
The costs of Medicaid are significant. They're always a target of cuts. They're really insufficient to provide the kind of quality care that long-term care organizations want to provide. So I think that's something that's going to be addressed probably through some kind of negative crisis at some point where, like the mental health world went through with Willowbrook. I think there's going to need to be some things that have to happen for people to wake up and understand that. So we're constantly trying to advocate and to promote seniors and their needs. They've paid a lot of taxes. They've done a lot of things to live their lives in a proper way. And it seems at the end of their life that there aren't the kind of dollars there for them that they need. So I think that's an incredible challenge. It will only get harder, I think, without being political. I just think whatever is in charge of the politics of the state and the country, they're challenged with a number of complex issues. Mm-hmm. And seniors seem to always be at the bottom of the list. So people like myself in this career and others are trying to get them to the front of the line always, to realize they've paid their dues, they've done their time, and they need their services. So I think that's something that will continue to be a tough topic going forward.
Yeah, for sure. They should be thankful that there's people like you, though, at the front lines, obviously advocating for them.
I'm on the way to becoming one of them. So, if you work in a place long enough, I tell people one day, instead of going home in the car, I'll just go in the elevator upstairs. But I might not know when that day is, but yeah.
I think you have a lot of years ahead before it's that day. But let's talk about RiverSpring Living. What is the one thing you want anyone tuning in to really know about the mission of the organization?
To care for people, whatever their needs are. I think sometimes people come thinking they need one thing and they really need something else. It's complicated. Even people that are brilliant in their fields of business have no idea what Medicare covers and Medicaid covers. So I think I want people to know they don't have to know what they need. They need to go to an organization like us, hopefully us, but others, with whatever's presenting with them, whatever they're seeing when they had Thanksgiving dinner with their family, or whatever when they talk to mom, what they're noticing. And talk to somebody who can guide them. It's a complicated maze of services and care and what's covered by what and what's this. And I think people need to talk to people, need to professionals, get guidance, get support oftentimes, because these are very emotional and challenging issues to decide when it's time for a placement or services. And bringing a home care person into your house is never an easy thing to do. Yep. It's necessary, but it's a little bit like matchmaking to find the right person. So I want to encourage people to reach out to us and to others when they're seeing something before it becomes a crisis. The worst time to make decisions is in crisis.
In the crisis, yep.
Yeah.
Great advice.
Yeah.
For those that are tuning in that might be interested in exploring opportunities within the healthcare industry, what is some advice you would give them?
Do your homework.
Hmm.
And again, as I said, do your homework early. Think about things. We had a reporter up from the Wall Street Journal doing a story last week, and the whole genesis of the story is what I was talking about in terms of the divergent needs.
Sure.
You're married, you're happy, everything's wonderful, and who wants to think about things when it's not going to be wonderful? But it's important to have the conversations, to understand what the wishes are of your spouse, and sort of plan what if. I tell people when they're dealing with their parents who have challenges, go see places, talk to people, be ahead of the game a little bit, think about it. Even though they're tough conversations, it's not fun to plan a will, to do a will. It's not fun to go look at facilities that you're not going to want to need until
Yep.
you need them. But it's important. And
It's
I think these
important.
days it's important to do the homework and to be proactive.
Absolutely. So you obviously have walked us through your impressive background at RiverSpring Living. Looking ahead, when you eventually part ways, what do you want your legacy to be?
It's a great question. I've had the blessing of being involved in so many things over my career. I think, as I get towards this phase, dementia care is important to me. I lost my mother to it. I've watched people suffer for many years. And I think I want to be able to take that another step down the road. I talked about the trips we've done,
Yep.
but in terms of environments and the way people are treated, the way they're talked to, I really want to further that ball down the road so people are not scared of dementia. They know how to talk to people with it. They don't shun them,
Yep.
and they find a way to manage it because it's tough. It's complicated to be with somebody you love and to see them diminished and to understand that they can't do the things they once did. But it's important to find a way to create pathways and to support them while they're doing it. So I think I'd like to take dementia from the 10-yard line to the end zone.
I'm looking forward to seeing that happen.
Thank you.
Well, we covered a lot today. Do you feel like there's anything we might have missed that you want our listeners to know about RiverSpring Living?
I think I'm grateful that we've done this. I'm grateful
Yeah.
that they've listened to it, and I hope whatever's going on in their lives, grandparents, parents, that gets them thinking and talking, so they feel better prepared and less frightened of the topic. That will be a success for me.
Absolutely. If any of those individuals are tuning in right now, what's the best way for them to get information on RiverSpring Living and learn more?
So riverspring.org is certainly a way to find us on the web, or 56 Senior is a phone number they can call. So either way, we're happy to help anybody who has a need or thinks they have a need or just wants to better understand what services are available.
Awesome. Well, David, it has been an absolute pleasure getting to know you, learning about your background, learning more about RiverSpring Living and all the amazing work you guys are doing. We're really looking forward to it. So thank you so much for being part of the show today.
I really appreciate you having me. Thank you.
Absolutely. Thank you, everybody, for tuning in. And please tune in next week for next week's edition of CEOs You Should Know.